morning. My name is Dr. Afeng-nkansah from Ghana, pursuing the postgraduate diploma in diabetes. Today, I'm talking about microvascular complications of. It is important that we know what is happening or the pathophysiology of microvascular complications so that we'll be able to institute measures that will help in the prevention of these microvascular complications or their progression if they were to occur. Microvascular complications of diabetes affect small blood vessels, particularly the capillaries, and those that occur in the tissues where the uptake of glucose is not dependent on insulin, such as the eyes, the kidneys, and vascular endothelium. In the eyes, they result in diabetic retinopathy, the kidneys, diabetic nephropathy, and on the nerves, they result in diabetic neuropathy. Elevated blood glucose has a direct damage on the vascular endothelium. They are known to cause thickening of the vascular basement membrane of these capillaries, and these thickened basement membrane become very permeable and leaky to proteins and fluid out of these capillaries. As has already been said, the capillary basement membrane becomes thickened in the event of elevated blood glucose, and they become leaky or permeable to proteins and fluid out of these capillaries, as shown in the diagram below. Again, in the pathophysiology, as blood glucose is converted into glucose alcohol or sorbitol by aldose reductase, when there's elevated blood glucose, there's an increase in the sugar through this polyoil pathway, which results in conversion of more sorbitol. Excess sorbitol induces oxidative stress, which is one of the pathophysiological mechanisms by which these microvascular complications develop. Also, hyperglycemia or elevated blood glucose stimulates free radical and reactive oxidant species production, which result in cellular damage. Hyperglycemia also promotes the formation of advanced glycosylated end products, which also induces cell damage. This is shown in the diagram below. Diabetic retinopathy. It is the commonest of the microvascular complications, and it has been known to be associated with loss of vision. In the retina, the basement membrane becomes thickened due to sorbitol accumulation, oxidative stress, advanced glycosylated end products production, reactive oxygen species. The basement membrane becomes increased in permeability and they leak proteins. There's also microaneurysm formation. Intravascular coagulation which occurs causes retinal ischemia and formation of new blood vessels which are fragile and easily ruptured, resulting in retinal hemorrhages or bleeding. There's also fluid accumulation that results in macular edema and worsens the visual impairment. This is shown in the diagram below. This diagram of a normal fundus and of one showing diabetic retinopathy, where we can see new vessels being formed and retinal hemorrhages and cotton wool spots. Also, in diabetic nephropathy, there is thickening of the basement membrane due to sorbitol accumulation, oxidative stress, reactive oxygen species, advanced glycosylated end product production, and this results in leakage of proteins or glomerular hyperfiltration of proteins and microalbumin, which results in renal damage. This is shown in the diagram below. A healthy kidney and a diseased kidney with basement membrane thickened and leakage of proteins and microalbumin, as we see in diabetic nephropathy. Diabetic neuropathy also results from injury to the nerves from sorbitol accumulation, oxidative stress, and advanced glycosylated end products in the event of elevated blood glucose. This is shown in the diagram below. The diseased nerve becomes very active. There is numbness, there's pain, there's pins and needles. That is shown as some of the symptoms of diabetic neuropathy as a result of hyperglycemia. Since we now know what happens or the pathophysiology surrounding these microvascular complications, it is important now to know what to do when these occur. Microvascular complications are associated with increased mortality and morbidity, and so prevention and early screening to identify and manage the aggravating factors is important. Tight glycemic control, management of dyslipidemia and blood pressure, lifestyle changes including cessation of smoking and low protein and salt diet form an integral part in the management of microvascular complications. Screening. Screening for retinopathy should be done at diagnosis and annually for patients with type 2 diabetes and 3 to 5 years and annually for patients with type 1 diabetes. Testing for microalbuminuria can also be done at diagnosis and annually for patients with type 2 diabetes, and then 3 to 5 years and annually for type 1 diabetic patients. Routine and annual foot examination is also recommended as screening modality for diabetic neuropathy. Management of risk factors. Maintaining tight glycemic control so that the blood glucose is below the recommended 7 millimoles per liter is shown to minimize the progression of these complications. This involves using novel anti-diabetic medications, insulins, and various recommended regimens, basal plus basal bolus regimens of insulin administration. Blood pressure of 130/80 is the target blood pressure that has been shown to prevent microvascular complications. ACE inhibitors and ARBs are known first-line agents which are recommended. Statins are used in dyslipidemia and are recommended in prevention of microvascular complications of diabetes and cardiovascular risk. Lifestyle changes, including reducing protein intake to 0.5 to 0.8 grams per day, helps to prevent diabetic nephropathy. A reduction of salt intake to less than 2 grams per day is also shown to prevent diabetic nephropathy. Cigarette smoking has been implicated in increasing the risk of microalbuminuria, and its cessation is therefore advised. Moderate physical activity has also been shown to be beneficial in improving the overall quality of life and reduction of some of the risk factors associated with microvascular complications. It goes without saying that prevention is better than cure. And so, as we know about how these microvascular complications occur, it is important that we stick to some of these preventive measures, screening measures, and management protocols to help to prevent these debilitating diabetes conditions and improve the overall quality of life of the patient as we aim towards providing patient-centered care for our patients. These are my references, and I say thank you for your audience.